Hello, everyone. My name is Dr. Brian Ho, and I'm a neurosurgeon. And I had the great privilege of being the chair of the writing group for these American Heart Association and American Stroke Association updated guidelines for treating patients with aneurysmal subarachnoid hemorrhage. This is an area where nurses play a huge role. We welcome Kiffon Keigher.
I am a doctorate prepared acute care nurse practitioner. I have about 20 years of neuroscience and stroke background experience and really started in the neurocritical care environment. So I am really honored to have worked as part of this author group as a representative on nursing practice.
So, in addition to DCI and vasospasm, another major concern we need to have is hydrocephalus. Acute hydrocephalus occurs in 15 to 87% of patients. And if it occurs, we have a class 1 recommendation for urgent cerebrospinal fluid diversion with either an external ventricular drain, EVD, or lumbar drain. The important thing there is we have a class 1 recommendation that when you're placing an EVD, that you have a bundled EVD protocol. And for patients that have chronic hydrocephalus, then there's a class 1 recommendation that permanent cerebrospinal fluid diversion is performed.
Yeah, this is a really important topic for nurses, as much of the work around setting up the EVDs, implementation and initiation of an EVD. I would say that was something that really we did identify as an opportunity and a knowledge gap as our author group spoke about the literature and the research around EVDs, management, monitoring, insertion, weaning protocols. There's a lot of variability. We did design a class 1 recommendation for the initiation of an infection protocol for patients with an EVD in place. I think that's really important that our providers and our nurses at the bedside remember to initiate this protocol. In terms of other nursing assessment, it is important to understand other management properties around the drain. What type of dressing is being used? What is the frequency of the dressing changes? What is your weaning protocol? So, really establishing standard protocols around some of these frequent interventions having to do with drains is an important piece for nurses at the bedside to be educated on, to be trained on, and really to have it a competency around on a regular basis.